The playground went silent when 8-year-old Tommy hit the ground. Seizure, unconscious, not breathing properly. Teachers panicked, children screamed, someone called 911. But the school nurse didn't panic. She moved with military precision, secured the airway, monitored vitals, coordinated the emergency response like she was running a field hospital. The paramedics arrived expecting to take over, but found a medical professional who knew more than they did. "Ma'am, where did you train?" "Air Force, combat medic, 3 tours. Welcome to Hidden Legends." Before we dive into this powerful story of hidden expertise and life-saving moments, tell me in the comments what city you're watching from today. And if you believe the greatest legends emerge in our most critical moments, hit that subscribe button. Sarah Martinez had been nursing at Hillside Elementary for 5 years. The children loved her, parents trusted her, teachers relied on her. Gentle touch for scraped knees, patient approach to stomach aches, the right Band-Aid for every situation. At 34, Sarah was the perfect school nurse prototype, gentle but competent, caring but professional. She arrived at work every morning at 7:30, left every evening at 4:30, consistent, reliable, predictable. The nurse's office was always spotless, medical supplies perfectly organized, emergency protocols clearly posted, everything in its place. Children felt comfortable coming here. It was a safe space, a healing space. Parents appreciated Sarah because she was communicative. Phone calls for significant issues, written notes for minor treatments, always kept families informed. She maintained professional boundaries but showed a warm approach. Faculty respected Sarah because she was reliable, never called in sick, always available for emergencies, went above and beyond for students. But also quietly competent, her medical knowledge seemed deeper than basic school nursing. Sarah never elaborated about her past. "I've always loved helping children," she'd say. Simple answer, no details. Colleagues assumed traditional nursing background, maybe pediatric experience. Sarah Martinez had joined the Air Force at 21. Single mother, limited options, but a passion for military medicine. Stable career for her son, service opportunity for herself. Her medical aptitude was exceptional in basic training. Quick learner, calm under pressure, natural bedside manner. Instructors recommended her for aerospace medical service, a specialized training track. Her first assignment was as a medical technician at a base hospital. Emergency room experience, trauma response, advanced life support. It was a steep learning curve, but Sarah excelled. She was promoted quickly and gained additional responsibilities, specialized training, combat casualty care, battlefield medicine, advanced trauma life support. Sarah's goal was to become a combat medic, the most challenging assignment, the most critical mission. Her first deployment was Afghanistan, medical unit at a forward operating base, treating wounded soldiers, emergency surgery assistance, life or death decisions daily. Sarah thrived under pressure. Her second deployment was Iraq, embedded with a special operations unit, high-risk missions, remote locations, limited medical resources. Sarah's skills were critical for mission success. Her third deployment was near the Syria border, the most dangerous assignment, black operations support, tactical medical response, keeping elite soldiers alive in hostile territory. That deployment changed Sarah. Her medical expertise peaked, but the psychological cost was heavy. Combat stress, PTSD symptoms, readjustment challenges when returning home. Sarah's Air Force medical training was extensive. Advanced cardiac life support, pediatric advanced life support, trauma nurse core course, civilian equivalent, emergency room nurse plus paramedic plus trauma specialist. Combat medic training was different, limited resources, extreme conditions, life or death pressure. Fourth access in moving vehicles, airway management under fire, pharmaceutical interventions in field conditions. Special operations medical support was even more advanced, working with elite units, treating complex injuries, maintaining operational security while providing care. Sarah had become a top-tier medic. Her pediatric experience came from treating young soldiers, 18, 19 years old, basically children, scared, injured, far from home. Sarah's specialty was calming frightened patients while providing expert care. Her equipment familiarity was comprehensive. Military medical technology was advanced, often superior to civilian counterparts. Sarah could operate any medical device, improvise solutions with limited resources, most importantly, decision-making under extreme pressure. Combat medics make critical medical decisions in seconds, with lives hanging in the balance. Sarah was trained for years to maintain calm, think clearly, act decisively. When she transitioned to civilian nursing, everything seemed easy by comparison. School nurse emergencies, compared to battlefield trauma, were manageable. But Sarah kept her skills sharp. You never knew when they'd be needed. After receiving an honorable discharge in 2019, Sarah had transitioned to the civilian medical field. She'd used PTSD therapy, readjustment counseling, and career transition support. School nursing had been a perfect fit. Children reminded her why she'd become a medic, helping vulnerable people. The school environment was stable, predictable, positive. After years of chaos, peace was welcome. When Hillside Elementary hired her, Sarah was overqualified. Bachelor's in nursing, military medical experience, advanced certifications. But the hiring committee didn't ask detailed questions. They were just happy to find a qualified candidate. Day-to-day work was simple compared to combat medicine: scraped knees, stomach aches, fever checks, medication administration. Sarah could do this with her eyes closed, but she noticed things others missed. A child with an unusual breathing pattern, possible asthma development, a student complaining of headaches, potential vision problems, a parent describing behavioral changes, possible underlying medical cause. Sarah's assessments were thorough, her referrals appropriate, her follow-up excellent. Principal Mr. Johnson appreciated her professionalism, but never questioned her background expertise. Colleagues sometimes commented, "Sarah, you seem to know everything about medicine." She'd smile. Just experience. Never elaborated, never explained. Children sensed something special about Nurse Sarah. She was different from previous school nurses, more confident, more knowledgeable, somehow stronger. They trusted her completely. That Monday morning had started normally. Beautiful spring weather, children excited for recess, normal elementary school energy. When 10:15 a.m. recess began, Sarah was doing routine paperwork, medical forms, medication logs, parent communication. She monitored the playground from her office window, a habit from years of situational awareness. Tommy Wilson, 8 years old, 3rd grade, typically healthy kid. Playing soccer with friends, running, laughing, normal 8-year-old activity. 10:23 a.m. Tommy suddenly stopped running. He stood still for a moment, confused expression. Then, he collapsed. Sarah was immediately alert. This wasn't a normal fall, wasn't playing around. Something was wrong. She grabbed her emergency bag and ran to the playground. Her training kicked in automatically. Assess scene, approach patient, evaluate condition. Tommy was unconscious, not responsive to voice. Breathing shallow, irregular, skin pale, lips slightly blue. Classic signs of a serious medical emergency. Teachers were gathering, children were scared. The playground supervisor was calling the main office. Chaos was beginning, but Sarah focused on the patient. "Call 911 immediately," she instructed the playground supervisor. "Tell them we have an unconscious child, possible seizure, paramedics needed urgently." Primary assessment: airway partially obstructed, breathing inadequate, pulse weak but present. Sarah positioned Tommy properly, cleared his airway, began rescue breathing. Sarah's medical training was automatic. This wasn't a school nurse response. This was a combat medic response. Airway management, head tilt, chin lift, jaw thrust, manual obstruction removal. Tommy's breathing improved immediately. Circulation check, pulse location, rate, quality assessment, skin color, capillary refill, signs of shock, professional level evaluation, neurological assessment, pupil response, Glasgow Coma Scale, posturing signs. Sarah was evaluating for brain injury, stroke, metabolic emergency. Meanwhile, chaos surrounded her. Teachers panicking, children crying, administrators arriving. But Sarah created a calm zone around her patient. "I need everyone to step back. Give us space," she commanded. The authority in her voice stopped the panic. Mr. Johnson arrived and saw Sarah working. This wasn't the basic first aid he expected from a school nurse. This was advanced medical care. Sarah was checking vital signs continuously, monitoring breathing, maintaining airway. Her professional competence was obvious to anyone watching. Tommy began responding slightly, groaning, slight movement. Sarah recognized the positive signs but continued monitoring. "Tommy, can you hear me? You're safe. I'm taking care of you." She spoke calmly while continuing her assessment. Paramedics arrived 8 minutes after the call. They expected to find a teacher doing basic first aid. Instead, they found a medical professional conducting advanced patient care. "Ma'am, we'll take over," the lead paramedic said. "Patient is an 8-year-old male. Witness collapse during physical activity. Initial presentation: unconscious, compromised airway, shallow respirations. I've maintained airway patency, assisted ventilations, monitored vitals. Current status: responsive to verbal stimuli, breathing stable, pulse regular." The paramedics looked at each other. This report was professional level, not typical civilian first aid. "Ma'am, what's your medical background?" the paramedic asked while continuing Tommy's care. "Registered nurse," Sarah replied, helping transfer Tommy to the stretcher. "Your assessment was extremely thorough." "EMT training?" Sarah hesitated. "Military medical?" "Which branch?" "Air Force, combat medic." The lead paramedic stopped and looked at Sarah with new respect. "How long?" 8 years, 3 deployments. "Combat medic," the paramedic nodded. "That explains everything. Your patient care was textbook perfect." Tommy was stabilized and transported to the hospital. Diagnosis: complex seizure disorder, first-time presentation. Sarah's quick response prevented complications and possibly saved his life. Mr. Johnson had witnessed the entire interaction. When the paramedics left, he approached Sarah. "Sarah, I need to ask you something. That wasn't a typical school nurse response. Your medical knowledge, your emergency skills." "I did what needed to be done," Sarah replied quietly. "You mentioned Air Force combat medic. Can you tell me more?" Sarah was uncomfortable with the attention. "I served 8 years, medical specialist, Afghanistan, Iraq, Syria, specialized in trauma care, emergency medicine." Mr. Johnson was stunned. "You're saying our school nurse is a former military combat medic?" "I'm saying I'm qualified to handle medical emergencies, Mr. Johnson. That's what matters." News spread quickly through the school community. Nurse Sarah wasn't just a school nurse. She was a decorated Air Force veteran, combat medic, genuine hero. Tommy's parents arrived at the hospital and learned about Sarah's response. The doctor told them, "Your son was lucky." Whoever provided initial care knew exactly what they were doing. Professional-level medical response. The parents returned to school to thank Sarah. They found her in the nurse's office, back to routine work, humble as ever. "Ms. Martinez, we can't thank you enough. The doctor said you might have saved Tommy's life." "I did my job," Sarah replied. "I'm glad Tommy's okay." "We had no idea. Your military background, your medical training." "It's not important. What's important is Tommy getting proper treatment." But it was important to the school community. Word spread among parents, teachers, administrators. Their quiet school nurse was actually an elite military medic. The faculty meeting that week was different. Mr. Johnson addressed Sarah's background, commended her response, and ensured everyone understood her qualifications. "We're fortunate to have someone with Sarah's expertise on our staff. Her military medical training is an asset to our school community." Parents began seeing Sarah differently. Not just a school nurse, but a medical professional with combat experience. Trust levels increased dramatically. Tommy returned to school a week later, fully recovered. He made a special visit to the nurse's office. "Nurse Sarah, my mom said you saved my life." "Tommy, I helped when you needed help. That's what we do for each other." "Were you really a soldier?" "I was an airman, Air Force. I helped soldiers when they were hurt." "Like you helped me?" "Exactly like I helped you." In the months following the incident, Sarah's role evolved. Still a school nurse, but also medical consultant, emergency response coordinator, community health advocate. District administrators learned about her background, and asked her to develop emergency medical protocols for all schools. Sarah created comprehensive medical response plans. The Parent-Teacher Association invited her to speak about child safety and medical emergency preparation. Sarah was hesitant initially, but realized it was an education opportunity. Many medical emergencies in children are preventable with proper awareness, she told parents. Recognition of warning signs, appropriate response, calm action can make a difference. The local EMT training program recruited Sarah as an instructor. Her combat medical experience, combined with teaching ability, made her a valuable educator. But most importantly, children felt safer. Knowing Nurse Sarah had special training, had helped soldiers, could handle any emergency, gave them confidence, Tommy became her biggest advocate. "Nurse Sarah saved my life. She's like a superhero, but real." Sarah remained humble about the recognition. "I'm a school nurse. I help children when they need help. Everything else is just background." Mr. Johnson disagreed. "Sarah, your background isn't just background. Your military service, your medical expertise, your commitment to service, it all matters. You're exactly the kind of person we want caring for our children." A year later, Sarah received a Community Recognition Award for her service, both military and civilian. The hospital where Tommy was treated invited her to speak at their Pediatric Emergency Medicine Conference. "Military medical training doesn't end with discharge," she told the audience. "Skills transfer, experience continues to serve, commitment to saving lives never stops." Tommy, now a healthy 9-year-old, attended the ceremony with his family. During Sarah's speech, he stood up and clapped. Soon, the entire audience joined him. But for Sarah, real recognition came every day in the nurse's office. Scraped knees still needed Band-Aids, stomach aches still needed comfort, children still needed caring attention. The military had taught her to save lives under extreme conditions. School nursing taught her to preserve health in everyday moments. Both missions were equally important. Because that's what hidden legends do. They don't stop serving. They just find new ways to serve. Whether it's a battlefield or classroom, combat zone or nurse's office, the mission remains the same. Protect those who need protection. So I ask you, have you ever entrusted your children's care to someone like Sarah? Healthcare workers whose military background you didn't know, who you only saw as gentle caregivers? Share your experiences in the comments. Because here at Hidden Legends, we know that the greatest heroes often work in the most tender roles, quietly serving, gently protecting. If this story touched you, share it, subscribe, and help these powerful stories continue. We'll see you in the next legend, and until then, remember, your child's caregiver might be someone who's already saved more lives than you know. Service takes many forms. Sometimes it wears combat boots, sometimes it wears scrubs,